Let's talk about one of the immune disorders known as rheumatoid arthritis. In fact, the word arthritis literally means joint inflammation. Arth meaning joint and itis meaning inflammation. Arthritis is a large and growing public health concern in the United States. There are more than 100 forms of arthritis and related diseases. So let's go ahead and talk about the rheumatoid arthritis and its tests. Rheumatic diseases are among the oldest diseases recognized, but the cause of rheumatoid arthritis remains unknown. Genetic factors are important and should be considered as a factor. Now, this is different than osteoarthritis, which is arthritis associated with aging, but it does include juvenile idiopathic arthritis, which is basically juvenile arthritis or juvenile rheumatoid arthritis. Now, patients that have rheumatoid arthritis have a shortened lifespan, and the most frequent cause of death is cardiovascular disease. Patients that have rheumatoid arthritis may show a positive anti-nuclear antibody test. Some signs and symptoms of rheumatoid arthritis would be weight loss, fatigue, especially joint irritation and deformities, neuropathy, cardiac symptoms, and immune complexes being deposited in the lungs and kidneys. Rheumatoid factors are immunoglobulins of any isotype, so they can be IgM, IgG, or IgA, with antibody activity directed against the antigenic sites on the Fc region of human or animal IgG. The rheumatoid factors are actually increased as the disease worsens, and they are associated with some bacterial and viral infections, including things like hepatitis, infectious mononucleosis, and some chronic infections such as tuberculosis, parasitic diseases, and subacute bacterial endocarditis and cancer. Now, rheumatoid factors are actually decreased during disease remission. The major goal of treatment of patients with rheumatoid arthritis are to reduce pain and discomfort and to prevent deformities and loss of joint function. We also want to help the patient maintain a productive and active life. There's also anti-inflammatory drugs that can be used, known as the NSAIDs, which would include aspirin and ibuprofen. There are also glucocorticosteroids that can be used to treat rheumatoid arthritis, such as cortisone. And then there are some what we call the non-biological disease-modifying anti-rheumatic drugs, such as methotrexate. And those are all different ways that we can treat a person that has rheumatoid arthritis. There's a lot of testing associated with rheumatoid arthritis. One such test is called the rapid agglutination test, where we have a serological test for rheumatoid arthritis based on the detection of macroglobulins, collectively called rheumatoid factor. Rheumatoid factor behaves like antibodies against human gamma globulin. In rapid testing, sheep blood cells or latex reagent consists of stabilized RBCs or a latex suspension coated with albumin and chemically bonded with denatured human gamma globulin. The reagent serves as an antigen in the procedure. If rheumatoid factors are present in the serum, macroscopic agglutination will be visible with the reagent when it's mixed with the serum. The determination that rheumatoid factors are present indicates that a person has rheumatoid arthritis. Okay, and then other tests that can be done for rheumatoid arthritis would be C-reactive protein, and of course C-reactive protein is kind of an indirect way of determining if inflammation is present. That's usually a particle agglutination test as well, and that's going to be elevated in rheumatoid arthritis. We have anti-nuclear antibody testing, which we talked a little bit about in the autoimmunity lecture. And then finally we have CCP, which is cyclic citrullonated peptide antibodies, which are specific to rheumatoid arthritis. We have looking for rheumatoid factors, and then finally we have SED rates. And of course the SED rate will be increased in people that have rheumatoid arthritis. So those are the different tests that can be used to help diagnose rheumatoid arthritis.